What is a Medicare provider charge on your bill? Have you ever looked at your medical bill and wondered what a Medicare provider charge really means? It can be confusing, but understanding this charge is essential for managing your healthcare costs effectively. Let's break it down. A Medicare provider charge is the amount that a healthcare provider bills for services covered by Medicare. This charge is based on what Medicare considers a reasonable fee for that service. When a provider agrees to accept assignment, they accept the Medicare-approved amount as full payment. This means they cannot charge you more than your Medicare deductible and coinsurance. In this case, your out-of-pocket costs are generally lower, making it easier to manage your expenses. On the other hand, if a provider does not accept assignment, they are known as a non-participating provider. These providers can charge you more than the Medicare-approved amount, but there is a limit. They can only charge up to 15% above the approved amount, which is called the limiting charge. For example, if Medicare approves $100 for a service, a non-participating provider can charge you up to $115. When you see a non-participating provider, Medicare will pay 80% of the approved amount. You will be responsible for the remaining 20% plus any amount up to the limiting charge. If the provider charges more than this limit, they are breaking federal law. Sometimes, non-participating providers may ask you to pay the full amount upfront. After Medicare processes the claim, they will reimburse you 80% of the approved amount. You will need to cover the rest, including any difference between the Medicare-approved amount and the limiting charge. Understanding these charges is important for managing your Medicare costs and reviewing your medical bills. Choosing providers who accept assignment can help reduce your out-of-pocket expenses and simplify the billing process. If you do use non-participating providers, be sure to review your bills carefully. Make sure the charges do not exceed legal limits, and consider submitting claims yourself if the provider does not. In summary, a Medicare provider charge on your bill reflects the amount billed based on Medicare's fee schedule. It is influenced by whether the provider accepts assignment or not, with legal limits on extra charges. Understanding these details can help you manage your healthcare costs more effectively.